This is the Life's Journey with Best Friends podcast. Listen as two best friends for over 40 years share our experiences, insights, and unique stories. Several weeks ago, I put a message out onto social media asking if anyone had any interesting stories or something they maybe want to tell about themselves. And we had quite a few people that reached out and told me that they would love to talk about, there's all different things. It runs the gamut. So today we're going to have Sara on our show, and she's going to tell us a wild, wild story. So it'll be really interesting to hear. So I know everyone has their own type of stories when it comes to doctors, dentists, chiropractors, anyone that's like in the medical industry. So this is not saying anything bad about anything at all. This is just Sara's story and what happened to her. So please just keep that in mind. This is not something that we're telling you, don't go to a chiropractor, don't go to a doctor. This is just a crazy, wild story, which I'm sure we all have, but she was willing to talk about it. And I thought it was, wow, pretty interesting. So, it's one of those things where the truth is stranger than fiction. So Sara, thank you so much for joining us. I can't believe I actually get to talk to you. We've only talked over in Messenger for I don't know, 4 years. Yeah.
Well, yeah, maybe a couple of years.
Yeah. So I was so happy when I had put this out to social media and you were like, yes, I would love to tell my story. I love to hear interesting stories. I know that our BFFers love to hear them too. So honestly, I'm just going to leave it up to you, and you can talk as much as you want. And I might interrupt and ask questions, but
ask me questions. Sure.
Yeah, your story is crazy fascinating. So give us a little background and then take it from there.
So I reviewed the story in my head 100 times. I've told it several times. So stop me if anything needs clarification.
Sure.
So my name is Sara Freire, and I live in the Boston area. I'm married with 2 kids that are a 7th grade boy and a 10th grade girl, which is significant because this all happened when my daughter was a baby and I didn't have my son yet. And that's all part of this story. So the story is about a life-threatening injury that I didn't know was life-threatening until 2 weeks later. The headline is "A chiropractor tore an artery in my neck," and I live to tell about it. That's the story.
Just absolutely mind-blowing, because I just recently have gone to a chiropractor. I will tell you, I had a great experience. He really helped me out. But to think that what I did, what do you mean you could tear an artery? So when you said that, I was like, oh my gosh. All right. So tell us what happened.
Yeah. Okay. So I'm a headache person. I've had headaches for decades, and I was on I was working with a neurologist and was on meds before this all started. So I had been on this regimen for for a couple years, and then I got pregnant and had to change my treatment plan. And so he had said to me, well, we have to stop everything during this pregnancy. But when your daughter is a year and a half to 2 years old, you'll know to come back to me and we'll calibrate. So sure enough, she's 18 months old, and I'm like, oh, guess what it's time for. So my hormones were settling down, and I needed to, set that up again. And so I made this appointment with him, and but he's a busy guy. So this appointment is weeks away, right. And I'm getting worse and worse, and I'm just at my wit's end. And I'm chatting with my neighbors, and one of my neighbors is a chiropractor, and he says, well, chiropractic care is great for headache relief. Come in and see me. And I was I was desperate. I was whatever. I kept my neurology appointment on the schedule. Never assumed that I shouldn't go back to him. But of course the chiropractor's he's oh, this is great. This is all you need. And I'm like,
okay, yeah.
Anyway, it just, in the moment I was desperate. I was willing to do anything. So You book like a little series, again, something I didn't know. You book a little series, you go in, and the first 2 days, the first two, like Wednesday, Friday, I was learning what it felt like to go to a chiropractor. It is a little odd if you're getting your neck adjusted. Anyway, for
It
people that have
is.
been, it's a little, yeah, like you feel kind of a rush of your circulatory system, and um, I learned not to be alarmed by that. I was like, okay, whatever. But he said like it'll take a few sessions to sort of really have like, you know, days relief and this so that you don't just wake up every morning with a headache. Okay. So the Monday, the third session, I go in and I sit, and my husband happened to drop me off for this appointment because of our daughter's daycare schedule, whatever. And I go in and I'm on the tail. It might have been the first adjustment. I can't remember, but he adjusts me and instantly it was like, pow, like something is different than the first two times I was here. And I remember saying immediately, oh, that was different. Something happened.
Was it painful or was it just like something, I don't know, just something
So,
different?
do you get migraines?
Yes.
Okay. So I said, I just got a migraine. And he said, what do you,
Instantly.
he goes, what do you mean? And I thought of like reacting, like, what do you mean? What do I mean? I was like, well, and I said, and again, I'm a clinician by trade. Many moons ago, I worked in the healthcare industry. And so I wasn't new to like terminology like this. So I said, uh, I I thought a migraine like evolves, but I got one, like I got one, and I couldn't know. I like was stammering. I was like, I got a migraine right now,
Oh,
and he was asking me like, what do you mean? I'm like, and I literally am thinking like, do people just get migraines like in an instant? Like, no, I don't know. What do you want? What else? So I'm starting to describe my symptoms, and I said, well, I'm laying on this table and I feel dizzy, which is odd. Um, I have snowy vision, which if you get migraines, one of the
yep.
aura is like little speckly, like glittery vision, like
Right.
like the televisions in the 80s that were, you're between channel 2 and channel 4 and
Yep.
yeah.
Yeah,
So
exactly.
yeah, so I said I have snowy vision, I am dizzy, and I have this searing pain, and the pain started here, below my ear in the
Oh,
back, and it traveled in like a little lightning bolt, traveled around my ear and to my temple
oh,
in like an instant, like it was like a zing.
right.
And I have this immense, immense pain in my head. And of course, if you get migraines, my migraines are not at my temple back here. They're
No,
like
here
here, like
and
all
behind.
the way
Yeah,
here,
and
like
behind my
eyes,
eyes. Yeah.
hairline. Yeah.
Yeah.
So I'm like, I don't know. But of course, not knowing what I'm trying to describe, I just kept saying, like, I don't know. What do you want me to say? I got a migraine. This gave me a migraine.
Right. That's the only thing you can associate it with to describe what the
Right.
change you had. Okay, sure.
So he's not particularly alarmed. And he says, well, come over to my desk and sit and have some water and we'll chat a little bit. And I was like, all right. So I get up and I'm so dizzy and I'm sitting down and drinking water and talking to him, call my husband, tell him that something happened and I'm okay, but like, don't dilly dally, like swing
Yeah.
back around in 10, like come back soon. So, these appointments are like 50, 20-minute appointments. Like it's not
Right.
like I'm there for an hour. Like I was like, hey, don't go too far, come back around. So he says to me in this moment, he says, sometimes the vertebrae don't like the order in which they're adjusted. Let me try something else.
Oh, good Lord.
And I thought, and like I'm kind of a self-deprecating, like sarcastic person, and I thought, the vertebrae like don't like what do I give it like they don't like something like I'm in control so I was like whatever, and so he said let me try something else, and I thought, well, you're the expert, like I'm here,
Right.
like
Right.
you're an actual practitioner of some sort, people say. So uh so I got back on the table, and again, you're supposed to relax, like this is all supposed to be very calm and you're supposed to
Yes.
relax, and I'm like, okay, well, I can't relax. so he like torques my neck again, and I'm a little bit resistant, but I'm supposed to be relaxing. And sure, like whatever, and nothing helped. And so he says, okay, your husband's on the way. I'm so sorry. I have another patient. Keep drinking water today and rest, and I'll call you in the morning. It was like, take two of these and I'll call you in the morning.
Yeah, right. That's what it sounds
So,
like. Okay.
so I'm like, all right. So I go to sit in the waiting room, and I'm like really dizzy. I'm nauseous, and I'm not a thrower upper. So to be nauseous is very unsettling for me. So I go to sit down, and my husband texts me that he's there. And this is, sorry, did I say this? This is 15 years ago.
Okay.
So this is 2010. And so he texts me, and I get up to go down the hall from this waiting room to go to him. And I can't, I'm so off balance. My equilibrium is so off that I'm using my shoulder against the wall of this hallway and like sliding myself along this hallway.
Oh my gosh, like you're in a fun house or something.
Like, yeah, well, I mean, you furniture walk when you're dizzy, but like
Yes.
I needed more surface. I like was
Okay.
sliding myself along this wall, and I get to the car, and he's like, what the hell happened? And I said, I don't know. And he says, well, do you have any Excedrin migraine? And I said, no, I've been guzzling those because of these, like, that's why I made this appointment.
Right, right.
Out. And he was like, well, so meanwhile, I also remembered he's supposed to go to the Red Sox game tonight. I'll be home with my daughter, who again is a toddler and like needs me to be on. And I don't want to be on. I want to be off. So, um, so we're going to stop for Excedrin at Walgreens on the way home. He's going to leave me in the car with this baby, and I'm not going to have it. So I volunteer to go into the store, and I only add these details because it gives you, like, there are core memories that I've developed that help you
Yeah.
visualize what I'm going through. So by this point, a migraine sufferer, they don't like the lights on. So
Yeah, right.
and this is May, by the way, it's May 2010, so it's like sunny out, and I'm covering my, like you do it outside. And I get into Walgreens, and thankfully it was quiet in there, but still it's fluorescent lighting. I get to the medical aisles, and I can't read the labels of any of the products.
Oh my gosh.
So, and I'm literally like, am I like, oh my God, I'm like, so, and by this point, I'm super dizzy. I'm nauseous. Light sensitivity is very strong, and I can't read the labels. And I go back to the pharmacist, and I just want to get in and out of there so fast. I walk back, and I'm like this. And I said, I'm so sorry, sir. I have a migraine, and I can't find Excedrin migraine. Can you just get it for me? And thankfully, like, no, I don't even know if he said anything. He just came out and got it for me and hands it to me. And I'm looking at this label like, well, I kind of recognize the colors. But if you think about when you write something in ink, in like a wet ink, and you smear it,
Yes, yes.
or like paints, you put dots of paint and you smear. That's everything looked smeared to me.
That must have been very scary at that point.
Yeah, because I'm thinking, what kind of migraine is this?
Yeah.
So he hands me the Excedrin migraine. I go, no generic, by the way. I was like, I'm splurging for this. Okay, so skip, no coupon, no lollipops to get out, take the Excedrin in the car, get home, pull in the driveway, and my husband says, should I not go to this game tonight? And I am not the wife that's like, stay home for me, honey, like
Yeah,
skip your plans. I'm not like that.
right.
But I said, maybe. I was like,
You whispered,
yeah, I was like, maybe.
if it's your idea,
Right.
yes.
Right. If you suggest it,
Yes.
yes, stay home.
Sure.
So then, because I said, I can't handle this. I can't handle the baby.
Yes.
So he was like, okay. He goes, well, do you want to go to the hospital?
Yeah.
And he asks me, he's worried. He's always worried, which is adorable in a way, but he's always like, should we go to the hospital? And I'm like, no, they don't turn the lights off for some patient. And this time I said, maybe.
So he like probably instantly went, oh shit.
I didn't say yes, but I was like, oh,
but maybe.
So he was like, shoot, she's like, if she didn't say no, we're
Yeah.
going. So he takes the baby, he texts the neighbor, not the chiropractor neighbor, the other neighbor, of the three of us that are friendly.
Yeah.
Um, and he hands her over the fence to the neighbor with two diapers and was like, "We'll call you later."
Oh my.
So we go to the hospital, which was a community hospital. Nothing to write home about, not a great place, but it was the closest one. And
Right.
um, he drops me off at the door. I get in. It's totally barren. There's nobody there, vacant. I was like, zombies are going to come out from around the corner. Behind registration, there was nobody there except for an empty wheelchair with an IV pole with saline hanging. And I was like,
What? Yeah. You're right. I
I
would
literally was like,
say
what?
the same thing.
Are they filming a TV show?
Right. Yeah.
So, and I just have these like vague even with my weird vision, I can like see, I can see that like nobody's there to help me. So, okay, so cut to like finally somebody shows, and on the admission, the thing that I told her
Yeah.
was sudden onset migraine due to chiropractic adjustment. That's what I said.
Okay.
And this, however many years of specialty training this person has, is not alarmed by this at all. And again, I don't know. I just think it's a migraine. I'm just like, I got a terrible migraine from something and it seems weird to me. So I get taken back. And by this point, I'm like not even opening my eyes anymore. I can barely see anyway. I have
Huh.
such pounding headache, pain in my neck, like massive throbbing. So they hook me up to morphine, and they take me for a CT. The neurologist checks the CT and says that there's nothing wrong. And now like 6 or 7 hours have passed.
Ah,
And at this point, like I'm just sitting there, like with a massive headache, and morphine isn't even helping
I
me.
was just gonna ask. The morphine didn't help. Nothing. You were. I was gonna say if the
No,
morphine helped, you'd be like, "Hey, can I get some of this to go home?"
totally.
I need
Okay, so interesting you say that. So I'm sitting there in this room, like dark, like I made them turn off the lights in my room. It's just like the glow of the whatever behind the bed, right?
Oh
That like
yeah, that
little,
weird
right,
thing.
a
Yeah.
little light, but no overhead lighting. And I'm looking at this clock. Well, I didn't know what it was at the time. I'm looking at this thing on the wall. And I said to my husband, his name is Mike, and I said to my husband, what what is that? And he said, it's a clock. And I said, well, why is there a red 13 on it? And he said, well,
What?
it's a military clock. There's a black 1 through 12 and
Okay.
a red 13 through 24. So you see the red 13. And I said, well, where are all the other numbers? And
Oh,
he was like, and he goes, you're so high. And I go, no, I'm not. I'm like, I am not high. I can't see that clock. Like, I don't know where the hands are. And so later on, I learned that the term for that is pinhole vision, where like if you hold your hand up, the
yep.
only thing I could see, because again, I've gone through various visual disturbances. I had the snowy vision at the chiropractor's office. I had this weird smeared vision, like almost like a kaleidoscope where
Yeah.
all is shards of color and it's all repeated. And then now I'm sitting here like hours later and I only can see whatever I'm looking directly at, and there's no peripheral vision,
Wow.
none. Like if it was either snowy or black, and I could literally only see precisely what I was looking at.
I would have
So,
thought I was having a brain aneurysm or something at that point,
well, I
right?
had CT that the neurologist was like, nothing. I don't know. So at like 11 o'clock, the nurse comes back in and I was like, hey, what's up? And she goes, well, they think it's just a really bad migraine. And I was like, well, I can be at home with a really bad migraine. I don't need to be sitting here.
Right.
So
Right.
she sent me home with Vicodin, which I had taken, like that was my breakthrough med. I had taken Vicodin before. I was comfortable with that.
Yep.
And but I was like, if migraine isn't touching this, what's Vicodin gonna do? But nonetheless,
Right.
they weren't coming up with anything brilliant, so I was gonna go home. So the next day, I happened to be off work. I was off work Monday, Tuesday. Anyway, and the chiropractor calls me. Hey, how you doing? And I was like, well, I was at the ER yesterday and I know something's wrong with me. And I got a CT scan and it was negative, but I just really don't feel good. Like on my vision, my head, I just don't feel good. I'm very foggy. And he goes, well, do you want to come back in tomorrow? And I was like, I do not.
Hell no. No, thank you.
So I declined that appointment. And then I just sort of like vegged out. I was taking Excedrin, I took a little ibuprofen, I took some of the Vicodin. It was too strong for me. It made me feel sick. And so the next day I was supposed to go back to work. I had this like Monday, Tuesday off.
Right.
I go to work and I worked at the time in an office setting with cubicles and fluorescent lighting. And I asked my whole section, I was like,
Oh,
anybody mind if we turn the lights off?
they must have been like, oh no, what's wrong?
So yeah, so they obliged, and we were working in the dark the rest of the week, Wednesday, Thursday, Friday. I wore my sunglasses to work. I in with computers. I let everything go to voicemail. I was so like, do you know that post migraine day? You're like hungover.
Yes, exactly. Yeah, and you still have the aura, and you're just like, yeah, yeah.
Yeah, you're just like, I can't think too hard. I can't answer I certainly can't talk on the phone with like
And that's a great
like
way to describe it. Like you have a hangover. Totally. I never thought of it.
yes,
Yes, exactly.
like yeah, you're just depleted.
Yep.
And so, okay, so that was Wednesday, Thursday, Friday. The next week, I'm kind of like back to normal. My vision is settling. I didn't need sunglasses inside. Uh, I was driving myself. Like I kind of figured I was doing fine.
Right.
And that neurology appointment. So I had this event on a Monday, and the neurology appointment that I had been waiting all these weeks for was a week and a half later the following Friday.
Okay.
So I coast along, taking Excedrin, taking ibuprofen, not really doing anything. Like I'm sort of like slowly coming back to
Hmm.
normal, but it's not like I woke up one day and felt fine. Like I
Sure.
was kind of like, ugh, like this will pass someday.
Yeah, right.
Thank God I have that appointment. So I get to this appointment and I'm just like, we're kind of shooting the shit with the doctor. And he's asking how the baby is, and here are your meds. Yes, I need meds. Here are your like every just update, like super nice, like 10 minutes. Let's get me out of here.
Yeah.
The whole time I'm like sitting like this, and I'm like rubbing my neck. He goes, "What's?" He's like, "Okay, it's like thanks for the update. Glad all the prescriptions are in. Yada yada. What's up with your neck?" And I go, "Oh, I have this like pinched nerve." And at the time, it was just sore.
Yeah.
And I go, "I have this really weird pinched nerve." That does not, but it doesn't radiate down my back like a normal pinched nerve would. I don't know. It's just weird. And he goes, do you remember when that started? And I was like, I go, actually, I do. I said, you're going to kill me. I couldn't wait for this appointment and I went to a chiropractor and it started then. And he was like, really?
Oh,
And he completely flipped to like, please tell me more, say more things.
right.
So, and he's like, say more things and follow me into this other special room.
Oh my
So,
God.
so I'm literally just like, yeah. And then I went to the hospital and then it was so weird. And then I went to work and I was wearing sunglasses. Like I was literally just like, yeah. So anyway, so we done? Like I was like, what else? So meanwhile, he's like doing the reflex test on my knee with the little
Oh yeah, the little,
balance, whatever
yeah.
that's called. And and he's like taking my blood pressure and like asking me how my driving is and how are my like can I turn my neck? And I said, well, it's pretty tight to go this way. I was like, driving? I don't know. I'm getting to work and back. Like
Right.
I
I'm not
like
hitting
I don't know what's up.
anything. No one's giving me the finger driving by.
Right. I was like, whatever. And he goes, okay. And he goes, and you said you had a CT scan. And I said, yeah. And it came back negative. And he goes, well, I want you to go for another scan. And I was like, the CT scan wasn't enough. And he was like, I have a different one I want you to, again, like, so, like, I have a different one I would like you to take.
Right. Not panic mode or anything.
Yeah. No.
Yep.
So I go, okay. He goes, they're open to now the next day was a Saturday. He goes, they're open tomorrow. Can you get in? And I was like, Saturday? He goes, yep. And I said, I can't tomorrow. I have got a golf tournament that I volunteer with every year. And he goes, no, you don't. You're doing this. And I'm like, oh, but I've been doing this for years. And he was like, that's great. You're not doing it tomorrow. And I was like, oh, so sure enough. Okay. So so I'm going to book this appointment. And he says, okay, you're going to go tomorrow. If it's nothing, I'll call you Wednesday. That's my next office hours day. If it's something, I'll call you sooner. And I was like, all right. And I was like, all right, talk to you Wednesday. And he was like,
Yep.
yep. So I leave, I get this scan done. It's an MR, it's like an MRI,
Okay.
but it's called an MRA scan with contrast dye, which I think I have it tabbed on my phone. I'll figure out what it means again. So I go to the scan. Okay, so I'll have to, I must have clicked on something else. Okay, so it's a type of MRI for a particular type of tissue or soft tissue versus something else or veins and artery something. Okay,
Yeah.
so I'm at work on Monday. My phone rings at like 2 p.m. and it's the doctor's office,
And you're like, and your stomach went, what?
I was like, hey, I go, it's not Wednesday. And he goes,
No,
no,
it's
it isn't.
not.
He goes, no, it isn't. And I really wish my radiologist would have called me yesterday because this is like important. And I was like, Mr. Rogers.
Why are you so serious?
I was like, what's going on? He was like, all huffy puffy. So he says, like, where are you? You know, where are you? What do you do? I said, I'm at work. And he said, okay, I need you to go to the hospital. And I said, okay. And he goes, like, right now. And I said, well, my daughter gets off daycare at, like, I keep like trying to make plans. I was like, well, my daughter gets off daycare at 5 or whatever. And he was like, so I have to pick, he goes, you don't have to pick her up. Somebody can pick her up. It's not gonna be you. And I was like, God, you're always like messing up my plans.
Bossy.
So he goes, so he says, take this. So first he says, write this down. So I write down, he goes, write down left vertebral artery dissection. And I was like, what is that? He goes, it doesn't matter. Write it down. I was like, all right. He goes, write it down. He goes, I want you to know that we're going to talk about blood thinners and they might admit you for 3 to 7 days. So be ready for that. Make sure they page me when you get in. So I'm writing down like left vertebral artery section, blood thinners, 3 to 7 days, his name is Dr. Stakes, page 6. So that's what my sticky, which I've kept. And like every time it gets faded, I rewrite, like I just, and he goes, and I need you to make 2 phone calls. You're going to call your boss and tell them you're leaving and you might not be back for a week. And you're going to call somebody to get your kid. And I was like, fine.
Okay.
So he says, where's the closest hospital? I said, well, the hospital that I went to is this hospital, but the hospital I'm closest to is Newton Wellesley. So he's like, I have privileges in Newton Wellesley. Go there. I was like, okay.
Yep.
So I drive myself to the hospital. I park like regular. I take my little shoulder bag and I walk in to a very busy Monday afternoon ER with like kids and whining people and, yelling and crying and this and that's very busy. And I walk up and the woman, and I'm like in business clothes and I go like this. And the woman says, who's the patient? And I said, me, I have this. And I just like I have whatever that says. And she takes a look at the sticky note and just goes, oh, and starts typing. And I was like, I'm glad you know what the hell this is because I don't know what this is.
But for her to go, whoa,
I know. So yeah, I was like, all right. So she's typing, super like just like like typing, and I said, oh, and it says page Stakes when I get here. She goes, yeah, I already did that. I was like, oh, so I think he must have called. Sometimes doctors will call ahead.
Yeah.
But man, I'm so oblivious. First of all, I'm not bleeding.
Well, right. And you're walking and
I'm walking around. I've been driving for 2, like I literally am like, what's the big deal, you guys? So I get my little, like, I called it an Applebee's beeper. Like at a restaurant, you get a beeper that's like,
Yeah.
a buzz. So I like grabbed my little beeper thing and I walk in and I don't even sit down for like 10 seconds to text my husband that I'm there, like, and my buzzer goes off. And all I can think of is like, but I'm not next.
Right.
Like, there's other people that are
It's not
really.
Wednesday. Like, what are
Right.
you
I go,
doing?
there's other people that are gonna. So I get to uh registration and I was like, they're gonna be so mad. And she was like, they'll get over it. I was like, okay. And again, like I'm so unassuming. I have no idea what's going on. I'm just following orders, right? So I get
Sure. Yeah.
registration and we take my notes, whatever. And she says, okay, someone will be with you shortly. I stand up, I turn around, and I literally like almost hit this person and was like, "Oh, we're ready for you, Mrs. Fr-" I was like, "What?" I was like,
Oh my God.
so, um, I was like, "Damn, this is a great service here."
Right. I'm gonna come here from now on.
So I'm walking to go, like I'm walking through to get back to the ER. And again, I give these details because clearly this was urgent and I didn't know it,
Right.
which is fine because the doctor strategically did not want me to raise my blood pressure in this situation. So that's I always want to remind people that I'm telling, like,
Yeah.
I know it's a long story, but it's because you have to understand that I literally should be dead.
Right.
Like so and I'll get to like I'll sort of give a little diagram of what happened, but again, I'm so out of the loop. And everyone else is like, get this woman back, back here. And I told this woman that I was like, can I, like, I haven't even been here for 5 seconds. I gotta pee. And she looked at me like, really? Like, do you really have to go? Like, and I was like, damn. I was like, what did I say? So I go to the bathroom. She's like, scurry. She's like, we gotta get. So I sit down and she goes, don't get up. And I was like, fine. I like was like,
Bitch.
he goes, what? Yeah, I was like, dude, relax. Like everybody. So I was like, yeah. So she goes, well, you're seated, and so you can't fall. And I was like,
I
okay.
walked in here.
I drove myself. I'm so out of the loop. So the rest of that ER visit was kind of a blur because they were saying a bunch of stuff that I couldn't understand. Again, my husband meets me there. I don't even know where my daughter went. I don't know if somebody has her again. I have no idea where she went. And and so the reason why I might be admitted for 3 to 7 days is because depending on the blood thinner that they chose for me, I could either administer that at home through visiting nurses, or I would have to stay inpatient and have that administered and calibrated over the next few days. So the decision was I can go home.
Okay.
And I was like, oh, good. So I can work. And they were like, do you have to go to work? And I was like, yeah. And they were like, "No, you can't do that." So I said, well, I have a laptop. And they were like, dude, why are you trying to work so hard?
Yeah, and you still don't understand what the hell is
I don't understand anything. So meanwhile, so I had called my mother on the way to the ER that day and was like, hey, remember that thing I told you that was weird that happened the other day? I'm at the hospital. And she was like, what? So I'm from Chicago. My parents are still there. My mom happened to be in New York with my sister for something. And she was like, I'm leaving your sister. I'm going to take the train up to you. And I was like, okay, but again, like, what's all the fuss?
Right, right.
Like, again, what is the, so it turns out that my left vertebral artery dissection was similar to something that happened to my father 9 months earlier. Very coincidentally,
Really?
I know, it's like so bizarre. So he had a carotid artery dissection because of a car accident where he had like a little syncope episode, like he kind of blacked out while he was driving. And when he came to, he had rear-ended the car in front of him at a stop sign. And when the airbag deployed, he had turned his head and extended his neck. And so
Gotcha.
he had a similar event. I have no recollection of like that recovery. I wasn't in town. I was in Boston. I have no recollection of like how he fared during any of that recovery. But my mom instantly was like, oh my God, it's this. Like, I remember going through all this with dad.
Right.
Like, all right, well, I wasn't there for any of that, so I don't know. So so meanwhile, she calls my cousin, my father's cousin, who worked out of Leahy Clinic as a neurologist, but not for migraines. She works with another population. And so they're chatting about this, and instantly my cousin was like, a chiropractor, like who let that happen? But I didn't know any of this. So my mom is like, Anne wants to know why you drove yourself. And I'm like, for what? Like, why? What? I was like, I didn't drive. So she comes into town and I make a follow-up with my neurologist. He's like, okay, so now you have to make a follow-up with me and I'm going to, give you some more information. Okay. So meanwhile, the visiting nurse comes so Tuesday, the visiting nurse comes for the first day. This is going to be a 10-day visiting. Like I have to have a visiting nurse come every single day for 10 days in a row to give me a Lovenox to like take my blood,
Yeah.
then wait for it to give her whatever reading. And then she gives me a Lovenox shot, which is like the initial blood thinner that I'm going to be on until by 10 days, she'll have calibrated the exact dose that my body likes. And then I'm going to go to this Coumadin clinic, which is a blood thinner, a clinic at the hospital.
Yep.
And you have to do that every other day I think my protocol was you have to go Monday, Wednesday, Friday, for a whole month, Monday, Wednesday, Friday for a month. And then like Monday, Thursday, 2 days a week for a month. And then the third month you can go once a week. And then they determine like, do we need to do this? Like, do we need to prolong this protocol or do we have surgery or like, what do you need? So for starters, it's 10 days at home. Then like to be determined.
Yeah.
So so now it's Wednesday. It's been like 16 days from the event itself. And I go to the neurologist for a follow-up and I'm like, can you just speak English for me? What in God's name is this thing that
so no one has even told you at this point what it is. They're just like, this honestly, is what you have to do. Stop asking questions. Just do this.
It's very possible that the nurses, because I remember doctors and like, doctors and nurses and like physicians. Like I remember various people coming into the little ER room that I was in. And I remember them all like, so this is what happened. So you got it? And I was like, mm-hmm. Like, I think they all said so. And I was like, Mike, did you hear any of that? He's like, yeah. So I'm guessing that they tried to explain it to me. And I was just so I was so disoriented by the urgency of all this.
Yeah. Yeah.
Knowing that like I'm functioning. Like, what do you mean?
Right.
Like to find out that you have something wrong in your body that needs attention that you can't see or feel. And don't forget, like all I felt was really strong migraine symptoms. I'm like, what? Right. Like migraines are migraines. Like they go away. Like what's the problem?
Right. This one's gone away. What are you talking about?
Right. Like I've kind of gotten better. I don't really know. So I get to this Wednesday appointment and now he's going to draw me a picture. He's going to draw me a picture and he's going to like explain everything to me. And my mother's sitting there to like interpret and whatever and be a mom and stuff. So, and I'm 32 years old at the time. So I was like, I'm young and I'm like, what's happening to me? And like, what does it mean that it happened to me? Like what? So this is how he describes it. If you think of a garden hose, like the ones with that are green, that you wrap around. Okay. So a garden hose isn't just a single piece of rubber. It's like layers of strength in rubber. Like there's an inner layer and then there's like a mesh to keep, to reinforce it. And then there's rubber and then there's like another layer of rubber on the outside. And so he's describing this as like the inner sheath. That was a really inappropriate gesture. So.
I know. It's like, yeah.
So if you have this this vein, this hose, right?
Yeah.
The inner sheath got sheared, like if you give yourself like a Charlie horse, whatever.
Yeah.
It got sheared, and so it's not like the artery just broke in half. For sure, you'd bleed out and be dead, right?
Sure, right.
But just a shearing of it on the inside wall means that, like a paper cut, like you have a little shearing of skin and a little drop of blood. It's not going to gush. It's a very minor wound, but pretty shortly the blood is going to coagulate and it's going to it's going to heal in moments, right?
Sure.
So I have this like paper cut inside this artery, but because it's not a dry environment and there's blood rushing through, the little clot that was already forming immediately at that site is now either risking getting other red blood cells stuck to it and growing this little clot that's sitting at this point of contact, or it's going to break off and now it's flowing down the artery while it's because red blood cells stick to each other.
Right. Yeah, and they're very sticky. Yes.
Yeah, they're very sticky. So either the clotting is going to be at the site and it's going to create a blockage, or it's going to break off and be snowballing and growing and create a blockage somewhere else.
Oh, good Lord.
So a dissection is a cutting of some level of intensity, and it actually happened on the left side, but the way that the nerves run, the pain was projected to the right side.
Okay.
Which is why I felt everything here. And so he was like, so that's what happened. Now we put you on blood thinners to ensure that you have the least likelihood of a clot, and whether it's at that site or whether it travels. And then we have to reevaluate to see how that's location healed and whether we have to do surgery to extract a clot or to reinforce that location or whatever.
Hi, BFF listeners. We will continue the interview with Sara Freire in part 2 of episode 77.
You've been listening to Life's Journey with Best Friends. For details on any of the things we've mentioned in the podcast, including photos, visit our website lifesjourneybff.com. You can also email us at lifesjourneybff@gmail.com or visit us on Facebook, Instagram, or Threads.
Remember, no matter where life takes you, you are never alone when you have a best friend by your side. Until next time.